turn your head this way just a little bit. Oh, got it.
Oh. Oh my goodness. That might be the biggest crack
we've ever done, right?
I've ever.
Oh my God.
The other night, and when I was getting out of bed, I like jolted up and I could feel a straight tension just coming right down the back of my neck, into my shoulder blades, into my traps. And I was, for a long time, just going over the wall, trying to do wall angels, wall stretches, and I can't move. That's about the most I get on that side. And then on that side, I can't even get past there without a strain.
Which is worse though? It looks like less range motion to the left,
yeah.
and the pain is also worse on the left.
Yeah.
So if you're going to take one finger and you only get to point to one spot, where would you point to?
Funny enough, like right here.
Here, turn around so we can see. Okay. And that's not that funny because the neck anchor is that low.
Yeah.
So if someone's in a whiplash accident, right, they'll be sore all the way down to, if it was a woman, it would be her brow line. So that's pretty deep. Yeah. Now for a guy, we're going to get that mid-thoracic, but just to give you an idea, they'd have trigger points all the way down. And so neck rotation, neck flexion, and extension
The minute I look down,
connects all the way down.
Yep. So the minute I look down, it's a nightmare. I can't even get my chin past here, and then I can't go that way. Yeah. I can go that way with a little turn, but.
I also work on, you probably know, but I also work on horses.
Yeah.
And so I have a YouTube channel called Animal Cracker where I work on horses, pigs, dogs, chickens, cows, cats, everything. But you'll see a lot with quadrupeds. Yeah. You're a bipedal, you're on 2 feet. But the neck is so important, and it connects all the way down to the lower back. Yep. And what I mean is, I'm not saying the neck is the lower back, but the movement of the neck will have repercussions all the way down.
Absolutely.
And that's what I mean.
I mean, I'm also in this position every day for work. So
for people who don't know, tell us what you do.
So I have a gym in New York City called Grit Boxing, and then as well as that, I'm the director of talent for a company called Boxer, which is an at-home boxing product. I've been boxing for about 25 years. Yeah. So it's just something that the minute I get into.
But you get into that position, you feel it.
Yeah.
Yeah. You didn't even throw
I didn't throw a single punch. I
literally
got out of bed.
Just lifting your arms, you can feel it. Yeah. So start on your back, and we're just gonna start face up first, and we'll start looking at. I just want to feel the neck first. And then we'll turn you over in a second. We'll do, we'll go down into that scapula area. I'm gonna move this crunchy paper out of the way. So I'm pushing into this posterior chain of his cervicals, and it's lateral and posterior. So here I'm going straight posterior. Yeah. And these are all crazy trigger points on him. Yeah. Then I can push in a little laterally, so I'm going from the side to the middle. Then, and he's got really nice SEM, so you can see his SEM here, which stands for sternocleidomastoid. It goes from the sternum, clavicle, mastoid process. So it's got 2 points here and 1 here, and his is all tight. So here's the SCM, and the whole chain is tight on him. Then he also has tight scalenes. All that should be just nasty. These will get so painful that they're almost like excruciatingly painful. Oof. Yeah. I've known him for a long time, and he has a very high pain tolerance. So for him to wince means we're on something crazy. And I think probably the way you've trained or the type of athlete you've been, like if you stop to think about every time you got hit in the face, you would never do the sport, right?
No.
So people, especially in any type of boxing or combat sports or contact sports like football or soccer, where you're crashing into other people all the time, build up a very high pain tolerance, because if they don't, they're out of the sport. You just don't continue. But when I'm working with someone with that type of athletic background and they're wincing, you're on a bad spot.
Oof, right there.
Like here's another one. Oh, it just crackled. So a little pop just came out just by wiggling his head back and forth as I'm holding the trigger point. Oof. It's hard for me to guess which side's worse because they're both bad.
Yeah.
Sometimes someone clearly has one side that's bad, but you have both sides that are locked up.
Yeah.
We noticed that you couldn't turn as much this way, do you remember?
Yep.
So, but I guess what I mean is the good side's not that good either.
No.
When did this really start being noticeable?
2 days ago.
And you were on a flight recently, right?
Yeah, yesterday.
So that's probably no fun either when your neck hurts. Okay, now I'm going to have you lie face down, and I'm going to go into that shoulder blade area. Scoot down a couple inches this way.
Towards you.
Perfect, thank you so much. I'm going to start on this side, and then we'll do the other side. So I'm mid-thoracics. I'm at T7, left side, just a centimeter left of the spinous process. Now I'm coming up and it's getting worse. Do you feel that spot?
Yeah.
So I'm at T6, here's T5. T5's really bad. And I think the other side's even worse, so I'm gonna do that side in a second. But these are painful, right?
Yeah.
I don't get happy that we found pain. I get interested. I'm not sadistic where I'm like, oh good, we got pain now. That's crazy. I get excited of finding the location so we can do something about it. Yeah. I'm not telling you that anybody watching the video, I'm not, hold on, let me just get that. You'll watch me on the intercom. Follow me a quick second. You should see my office. Hi, who is this? It's my mom. All right, you can come up. Pull the door. All right, when you come up, we're filming, so just sit down, okay? My mom's here.
Amazing.
She lives on 35th Street. I'm from New York originally, so she's coming by to get a treatment. My mom is one of my patients. It's funny. I forgot that she's coming in this morning. But she's here early, that's why.
Oh.
All right, so we're back on this spot.
Feels right on the spine. Oof.
Actually, we can never come back and say hello. Come back and say hello when you get a chance. It's cold out, it's snowing a little bit, or something, rain or whatever it is. And here's my mom.
Hi.
It's my friend Anthony.
Hi, very nice to meet you.
Nice.
How are you?
Good.
He's making me feel great.
Me too.
Good to see you.
Good to see you.
All right, we're gonna
I'm early.
I know. So you're gonna go sit on the couch, and I'll be with you in a minute.
You got the couch. Yeah.
We got the couch finally arrived. All right. See, this is definitely behind the scenes. I'm not making this stuff up. Thanks for saying hello. Right in there. So right there is I think that might be the worst one.
Yep.
So I finally found that it's slightly right of center. I come to the tip of the scapula, which lets me know I'm at T7. So it's really between T7 and T8. And he's what people would typically call a pinch nerve. Now, in medical or science, is it a pinched nerve? Like, did a bone get two bones pinch a nerve? It's a little more complicated than that. So, in the common, speech, we call it a pinched nerve, and I'm fine with that. That's a good way to describe it. But it's typically much more complicated because you have a whole complex of muscles tightening and shifting the bones, and the ligaments pull unequally on each side, and then inflammation or edema is released in the area, and then that pressure of the fluid and the inflammation and the swelling puts pressure on the nerve root, and that would be more accurate of what we call a pinched nerve. But in everyday language, I call it a pinched nerve too, just because it's the common speech. But if a scientist was watching this, they'd go, well, it technically doesn't pinch between two bones specifically. Well, that's true. I understand that. But everybody calls it that. And it works. Now I'm going all the way down his back, and this whole chain is tight on you. Do you feel it? You must have been very uncomfortable on the plane. How long a plane flight was it?
It was only 45 minutes.
So that's not too bad.
No.
So I thought you might have flown from LA or something.
No, thank God.
All right, now lie on your back. We're going to do something good. Scoot down towards me a little bit. So now I'm going to put this arm here.
Mm-hmm.
I'm going to put this arm kind of up into your armpit.
Okay.
I'm going to trap the elbow, put my hand underneath.
Yep. Oh.
And I got it. And it started cracking before
Yeah.
I started.
Wow.
So that's that bone that was out.
Yeah.
And I'm going to do more now. You feel those pop too?
Yeah. Easily.
Yeah. Now lie face down. Oh, got it. And turn your head this way just a little bit. Oh, got it.
Wow.
Lie on your side facing me. You back on the road tomorrow, or you're
No, I'm good until Sunday at least.
Good. Come back this way. So if you're available, because we're here all day tomorrow.
Yeah.
If you're available, I'm gonna have you come back tomorrow and do one more.
Yeah.
And we can record that too, and then you can report how you're doing. My
Yeah.
expectation is you'll be 30% better by tomorrow,
Yeah.
maybe 50%. Then if we do another one, and tomorrow's Friday, you should be like 80-90% better by Saturday.
My neck already feels
Yeah.
great.
But you won't go all the way up to 100% in one visit because it's too locked. It was too locked up, and it was also inflamed.
Yeah.
So actually, come stand. See how that feels so far.
I have at least range of motion, which I didn't have before.
So I'm going to do a little bit in here, okay? Tilt your head back.
Oh, sorry, my ear is on it.
Okay, sorry.
It's okay.
So now try moving it around again.
Much better.
I don't think we should do more because it's going to be overdoing it.
Yeah.
And then if you're willing to come back tomorrow, you can kind of come back whenever in the day you have free
100%,
time. And we'll just do another little follow-up.
Yeah, I would love
Okay.
that.
All right.
I feel much better.
Go
already.
till tomorrow.
Till tomorrow. Thank
All
you
right,
so
thanks.
much.
All right, so we're back the next day, right? It's,
Yep.
It's the
It's
next
Friday.
day. And how did you do since yesterday?
Did well. My range of motion has increased significantly. Feel still a little tension in my lats, right by to the right and left of my spine in that area. But the increase of motion in my neck has been great. I had to teach yesterday, so that was really helpful. I was at a room of 54 people, and I didn't have to turn my body to talk to people, so that was
Okay,
great.
that's good. And then you said you also got a Thai massage?
I got a Thai massage right before this, around like 11 a.m., and that was great. They were like
Yeah.
working through all the kinks, which was great.
All right, cool.
Yeah.
So let's get you face down on this table.
Great.
I'll work at some of the muscle knots, even though you just got a massage. So I'm going to try not to overdo it. I'll put on the lower back stretching thing, which
Great.
stretches out your lower back, and just do a little bit of deep tissue on you, and then we're going to adjust you. Do a little bit more. And you said you had like one little spot up in here somewhere, right? Is it
Yeah,
on this
so
side or the other
It's on
side?
the opposite side,
Okay.
right to the
So, but this level probably, right? So it's up in
Yeah.
here somewhere?
right in there.
Ooh, okay, that might be it. That's it right there. Alright, so I'm just pushing in here. And this is your rhomboid area between the scapula. I'm slightly to the right of the spinous. So I'm between the edge of the scapula and the vertebra. And this little section is very tight on you. And probably tender too, right? Ooh. Ooh. Wow. Okay.
Yeah.
It's right in there. So it's really tight. I think it's this one too. Watch. That could be it right there, right?
Yeah.
Ooh. Okay.
Yeah.
So I'm gonna have you lie on your back next.
Okay.
Trying to get that part first, the
Yeah.
one that we just saw. So scoot down towards me. I'm gonna leave this hand low and this one goes up on your shoulder. I'm gonna come in and get my hand right on that spot we were just on. And then one this way.
Oh, wow.
That one you felt.
Yeah.
So we finally got it.
Yeah. Just felt like my body just exhaled.
Yeah, so that was a good one. I think there's a lower one too that I noticed. So I'm just gonna come down here. All right, that's fine. Oh, man. Line your side facing me this way, please. When's your next day of travel? Do you have to get on a plane again soon?
Oh, Monday.
So his lower back just popped.
Yeah, that was huge.
Monday you travel again?
Yeah.
What city will it be this time?
Boston again.
Yeah, turn this way.
Yep.
Boston's
45 to an
Yeah.
hour. It's not bad.
Well, I was going to say, Boston's one of these in-between
Yeah.
cities where you have to decide, do I drive or
I
do I
know.
fly?
And the fly is just as bad.
Yeah. Because you could drive in about 4.5 hours, right?
Yeah,
Or
and
4
you're
hours?
in the airport for an hour before the flight.
Right, so with the hour before the flight, then the flight, and
Yeah.
then like getting from the Logan Airport
To where I need
to
to
where
go.
you need to go, it starts getting close to almost being the same amount of the driving time.
Yeah, and the other thing too that people don't realize is that the train is astronomically long as well because you stop all the time.
Right, so that there's no great way to figure out
No.
the riddle of how to get from New York to Boston
No.
best.
No.
So let me move this paper out of the way. And you can drop your head.
Oh my goodness. That might be the biggest crack
We've ever done, right?
I've ever.
Oh my goodness.
I don't even know what to say right now. Yeah. Wow. Welp, that happened.
You ready to do the
Yeah.
other one? Smaller on that side.
Wow. That first one.
Yeah.
Holy jeez. Yeah, I don't even know what else to say. Like, that was
So that's all we're gonna do today.
amazing.
All right?
That felt
Come
incredible.
sit up and swing your legs this way.
Cool.
All right.
Wow. I could just start feeling like my body just breathe again. It's been so here for so long that that just amazing.
All right, we're done
Thank
for
you,
today.
boss. Appreciate
Thank
it.
you.
Thank you so much.
All right.
Oh my goodness. That might be the biggest crack
We've ever done, right?
I've ever.
Oh my god.